I am Diana Crane, and I will be presenting a program on information management and healthcare to senior level BSN pre-licensure nursing students. The information age has forever changed medical practice. We have results and images at our fingertips, and our patients are better informed as well. According to the Office of the National Coordinator for Health Information Technology, 84% of hospitals use electronic health records, and 87% of doctors' offices are using electronic health records as well. These store demographic information, diagnoses, lab tests, results, test images such as X-rays or MRI, clinical notes, and prescriptions. This was designed to increase the efficiency from a daily operations standpoint. The unintended outcome of this was a huge amount of data of medical patients, conditions, treatments, successes, and failures. The ability to use the electronic health record to predict trends and find patterns was born. Datasets are a collection of related sets of information composed of separate items. The set can be comprised of a few items or millions of items. Datasets are used in data mining. Data mining is the ability to use analysis that searches datasets for patterns or trends. This can be used to identify inefficiencies, best practices, and to generally improve healthcare. Examples of datasets are multi-user friendly and varied. One of them is the OASIS, or Outcomes and Assessment Information Set, which is a systematic measurement of the quality of home health services. It is used for reimbursement of services and gathers data about Medicare beneficiaries. This set also gathers core data collected on all adult home health care patients. The healthdata.gov site incorporates U.S. healthcare data for the last 125 years. This includes Medicare data, epidemiology, and population statistics. You can find data sets provided by agencies across the federal government, but also uses data handling, and it processes that data so it becomes useful. The World Health Organization provides data and analyzes this data on global health priorities. This includes disease statistics, health concerns, and is laid out so that each page has a specific topic and provides information on the global situation, and it highlights trends. The information also includes indicators, databases, and major publications that are linked right to the website, making it incredibly user-friendly. The Human Mortality Database provides detailed mortality and population data for about 40 countries. This is accessible for students, journalists, researchers, epidemiologists, policy analysts, and others, and is useful in determining human longevity and tracking its process over the years. Information management is an industry that's regulated by national and federal laws that include HIPAA and the HITECH Acts. The goal is to improve healthcare quality, safety, and efficiency. HIPAA is the Health Insurance Portability and Accountability Act. This was published in 1996 and set the core healthcare IT standards. Its rules regulate the use and disclosure of personal health information and establish national standards to protect it. Everyone who is in an electronic health record chart of a patient is held to this standard. The HITECH, or Health Information Technology for Economic and Clinical Health Act, was established in 2009 to improve healthcare quality, safety, and efficiency through the use of electronic health records. And it creates a private and secure electronic health information exchange. Both these laws insist on the importance of data interchange standards. This includes common coding specifications, medical templates, and information structures that allow data mining to take place and make this information useful. The data elements to be collected for each patient are then put into these different templates and specific coding standards to provide uniform definitions for common terms, which ensures that scientists are comparing apples to apples, so to speak. So the patient's privacy and safety is managed through the use of these acts and the ability of the providers and the people who use this information to be held accountable with fines and potentially termination or legal charges if they are not protecting the privacy of the patients. The ultimate goal is to provide safe, informed, and quality health care. So how does this help? Data is gathered every day on every patient and then is incorporated and stored by the electronic health record. The use of the electronic health record can increase efficiency for the entire medical staff, and that the chart can be accessed from many locations by all providers. This decreases time waste due to the provider being able to access test results off-site, and order placement can be done immediately. This also includes cell phone apps that allow providers to take pictures of, say, a wound in the healing process, and so multiple providers do not have to be present in the room. They can access the chart from a different location and see how the treatment is affecting the healing of that wound. They can then create care plans and orders based off that. It does help with safety as well, in that scanning patient medications decrease errors. The ability to program reminders into the medical record, or the MAR, can prompt providers to order lab tests such as a PT-INR for a patient who's on Coumadin before they order a dose. They're also now using this with potassium repletion. One has to have a current lab result on level of potassium before they can order more to be given to the patient. It also allows for the use of medical software that gives pharmacological information on medications right at the bedside, so patients' questions can be answered, and we can see how side effects might concern us, or what we may want to know, such as blood pressure, heart rate for different medications before we actually give them. They also provide a higher level of quality due to the increased speed and accuracy of treatment. This means that the doctors can collaborate while not being in the same room. And the added bonus is that all the data collected and the ability to access evidence-based literature to support the use of such treatments are improving with the technology as it moves forward. This allows doctors to support their treatment decisions right at the bedside. Information technology in nursing education is imperative. All nurses need to be competent at the use of the electronic health record and the ability to access evidence-based literature and sort through it so that they can see whether it's supported and relevant to their concern. It's a required part of nursing practice. This must be added to nursing curriculum to ensure that new nurses are competent and comfortable with these tools to ensure that nursing students are ready to practice at graduation. This can be incorporated in a number of ways by using unfolding case studies that include access to an electronic health record for students to use and practice on, using a practice electronic health record in the classroom, and it is the expectation that students, before they go to clinical, take a class in utilizing the electronic health record of the facility they are going to, and they will demonstrate the ability to add vital signs and assessment data into that electronic health record with the co-signing by their instructor. In summary, the electronic health record data sets and the data mining are new tools for the nurse to use in order to plan and deliver safe quality care to the patients. It needs to be used in classrooms to educate nursing students on its use and to promote competency with use so that they are ready to practice at graduation. It will change how healthcare is delivered, viewed, and transformed into the future by allowing not only the data sets of the patient demographics, information, and treatment to be used for research, but by allowing the medical staff to access this in a very quick, timely fashion at the bedside. Thank you.